Good morning, everyone. We're so excited to have all of you here today with us in Southern California. This is
Good morning. How are you?
the first opportunity that we have to share a little bit about St. Joseph Friendship Fund. For many of you, we've partnered for many years.
Gabby, I'm sorry, you got muted. Can you unmute yourself, please? Apologize.
Okay, ready?
Yes, thank you.
Well, good morning again. Hopefully I'm not repeating myself too much. I just wanted to express how excited we are today to be speaking with all of you here in Southern California. As many of you know, we've been here in Orange County, high desert communities for 34 years now as part of St. Joseph Community Partnership Fund. And now we have the opportunity to expand our work in this region and include Los Angeles. And so for today, we really want to engage in conversation with all of you. We'll share a little bit about who we are, but we also want to learn about your communities and your organizations. And before I get started, just want to let you know that if you have any questions throughout the presentation, please place them in the chat. We have allocated some time during the presentation to respond to some of those questions. And as the tradition of Providence St. Joseph Health, before we begin the presentation, we will start with a reflection from Sister Suzanne Sasses, the founder of the fund. Thank you.
At the heart of Catholic healthcare is the healing ministry of Jesus, taking care of the neighbor without distinction, taking care of the poor. St. Joseph Health has been doing care for the poor and community benefit since its inception and before its inception. But we didn't do it because of government regulations. We're doing it because it's the heart, it's the purpose for which we're in healthcare. St. Joseph Foundation, as it was originally called when it was founded in 1986, was founded at the request of the sisters who had said to our first CEO, how are we going to continue taking care of the poor? We're in this ministry. It is a ministry as well as a business. And the purpose of the ministry is to continue the healing ministry of Jesus. And if you go to the scriptures, you see that Jesus took care of everyone. He took care of them body, mind, and spirit. And that has caused us to do the best we can and to evolve as we saw the needs evolving. When we formed our health system, our fear was that our new leaders, who we irreverently then called the suits, because they were mostly men, might not understand how important all that was for us. So we said to our first CEO, how will you assure us that we can continue to take care of the economically poor? The Community Partnership Fund has been a way of expressing, of continuing our legacy of caring. I see the Partnership Fund as being the vehicle that's going to take our legacy of caring for the dear neighbor into the future. I've especially been proud of the systemic change that we've been able to bring about by developing communities, by empowering community leaders. That has brought whole neighborhoods and whole areas to a different level of well-being so that we can keep people well and keep them out of the hospitals. Everything in healthcare is changing. And if we are to continue what we call Catholic healthcare, there has got to go through all that change, the constant of the mission. I hope we all at St. Joseph Health and now Providence St. Joseph carry on this legacy of caring, which is also the legacy of the Sisters of Providence, by continuing to find structures, policies, and programs that will give stability to this aspect of our mission that can move into the future. The hope I hold and the vision I hold is that in the midst of the constant changing and evolution of healthcare, we will remain faithful to caring for the dear neighbor who is close or who is stranger, body, mind, and spirit, continuing to extend the healing ministry of Jesus.
The original plan for us was to be with you, would be with all of you, and to meet face to face and have more of a true open house setting where we could learn as much as we can, have our entire team there, offer opportunities for your organizations, your staff to interact. But as the world has turned, so has this opportunity. So we've moved virtual, and we're hoping that this is a first step in building and strengthening relationships with you in the community. I want to introduce myself. You heard from Gabriela Robles, who is our Executive Director of the St. Joseph Community Partnership Fund. I am Jason Laksamana. I am the Senior Program Officer for the fund. I know, looking at the list of folks who have joined, I know many of you already. There's a few that I don't know, but I'm happy to meet you virtually and hopefully meet with you over the phone and Zoom and eventually in person. On our call with us today are members of our team as well. Elisa Barrios, who is our grants manager, Carrie Schonwald, who is assisting us and is within the partnership of our Providence St. Joseph Health family, and Teresa Beard, who is also assisting us. It was a little spotty in the video. We apologize for that, but just want to reiterate that the fund itself was founded in 1986 by the Sisters of St. Joseph of Orange. And for those of you calling from Orange County, I know there's a deep history in Orange County as well as the high desert. There was a history of focusing on health, making this an extension of the ministry beyond the hospitals. Even for those of you who are already partners with us, the following might be new information. Now that we are joined with Providence St. Joseph Health, we are excited and honored for this expansion to continue this good work and for us to move forward to honor the legacies of the Sisters of St. Joseph of Orange and the Sisters of Providence. Again, we will have time for questions and answers towards the end. We have close to 100 people participating. That's really exciting. Makes it tough to have to raise your hand and jump in. So please, if you have questions, enter them in the chat. Anything about the fund, about our initiatives, about our history or direction, we can get to that. We'll also have, through the wonders of Zoom, an opportunity to have a little bit of a breakout. So there will be a little bit of interactivity towards the latter half of this presentation. I want to talk next a little bit about our mission. On the slide here, on the next slide here, is our mission. Our fund, as an extension of Christ's healing ministry, provides funding and assistance to improve the health and well-being of the economically poor and utilize the strengths and diversity of our neighbors to build vibrant communities. What this means for us is that it's about community. It's about partnership and resources. It's in our name, Community Partnership Fund. But really, it's in service of the most vulnerable and marginalized in our community. We'll get into that a little bit more later in the presentation. I want to turn it back to Gabby to talk about our leadership and our structure and relationship within the larger Providence St. Joseph Health System.
Thank you, Jason. And not only are we not together as a community today, Jason and I are even in different places. So thank you for your flexibility. Just want to share a little bit. Jason touched on what is the current leadership within the fund, as we call it. And I lead the fund along with my team, with Jason Laxamana and Elisa Barrios. And as Jason shared, we also have Carrie Shonwall and Teresa Beard on the team. The fund within Providence St. Joseph Health sits within what we call the Community Partnerships Division. And you can see the breadth of work within this division. This includes our government affairs, our community health investment, or many of you may know it as community benefit, our focus on education, philanthropy, global and domestic engagement, and the fund. And so this is an opportunity for us and to share with you that within Providence St. Joseph Health, we're part of a network that there's a lot of gifts that we can bring together as a team and really think about how best to be strategic in how we engage in the community. So really looking forward to sharing more about the work of the division as we move forward in this relationship. Next. You know, and in what we do, I think, you know, Jason shared a bit about when we look at the mission statement, what that means to us. And unfortunately, the video wasn't as clear, but it resonates, I'm sure, with all of you. The underpinnings of the legacy of the Sisters of St. Joseph, the commitment to respond to the needs of the poor in partnership. And I think that is one of our values. We don't do anything alone. We want to be strategically aligned with the system. We want to develop these strategies and really think about how do we enhance our impact. But we want to walk with others. We want to bring partners within the system, in the community, and really looking at partners throughout the country, the system. So funders, policymakers, other health systems. We need to work together in supporting our communities, and at the same time, partner with our communities so that we can really be part of that change. Next, please. Okay, Jason.
So I'll jump back in and really share that. Again, we want to make this an interactive opportunity. And so we're going to have a few poll questions. And I did want to introduce Paul Bonfanti from Charitable Ventures, who's assisting us in this presentation. We've set up a little bit of some questions here to help us understand who's with us on the call today. And also, we can use this information to assist in some additional strategic planning that we have throughout the year and the years to come. So the questions that we have here, take your time. You'll see as you answer them, it update live, so we can see and everyone can see who is with us. The first two, how familiar are you with the St. Joseph Community Partnership Fund? The second, what are the primary focus? What is the primary focus of your organization? We'll get into the third question. Which of these populations do you serve? And what county or counties do you operate in? I know that we have folks on the call from Orange, from San Bernardino, and from Los Angeles County, and maybe some other folks from outside those counties too. And again, partnership is in the name. We don't view ourselves as a traditional grant maker. We believe that in order for us to address needs in the community, it takes a partnership. It takes authentic conversations and co-strategizing. So this is all important information to understand where you're coming from, who we're working with, and what we can do together. So we'll take maybe another minute to allow people to jump in. I know that we've had a few responses already, but we have close to 100 people on the line. And then we'll move into the rest of our presentation.
And this is Paul. Thank you, Jason. Just a quick addendum. We could only choose 10 items in Zoom polls. So for instance, for your focus or populations, you may not see yourself, feel free to use the other button we'll have an opportunity in the breakout for you to identify yourself a little bit more.
Thank you.
And as of right now, it looks like about 2/3 of the participants have voted, so we'll give it another minute or so, please.
I feel like we need some music in the background.
Paul, we had a quick question. There's a question about how to vote. There might be some difficulty on some user ends. And I realized that looks like for some, the submit button is not working. I realize that there might be some difficulty if some people are on different platforms. If they're not on a desktop or a laptop, it might be from your phone or iPad. It might be some limited. Paul, is there any other insight?
If you are, yes, if you're on your phone, you may not be able to vote. It looks like we've got 56 people who are voting. So if you do not see the submit button, you may just try scrolling down. You should see some check boxes or circles you can check. But if you don't see that submit button, then I apologize. You may have to answer all 4 questions before you can hit submit. And then again, if you're not able to submit these results, we'll certainly be hearing from you in the breakout.
Yeah, and the submit button it seems like some of the users are able to provide some information that if you scroll all the way down, you may be able to see that submit button. If not, again, like Paul said, there is an opportunity during the breakout. And as well, you had to register for this, and we do have your information. We're happy to follow up. And this is a first step. We're happy to have follow-up calls, follow-up Zoom meetings with you or your staff to learn more about you and for you to learn more about us. So if you're not able to log on here, that's okay. So we'll give another, we'll say 10 seconds, and then we'll move into the next slide.
We've been.
So you could see. Oh, Paul.
Jason, we've been kind of stuck on 57 for a while, so I'm going to end it, and now the result of the final should be viewable to everybody.
Great.
Thank you. Okay, so now we're going to share with you a bit about the strategic framework of the fund.
Great. So thank you, and you can see the poll questions. We have a lot of we'll say partners that are familiar with us here. We have a few that are less familiar, and so welcome to you. We have folks that run the spectrum of different needs in our community, from arts and education, domestic violence, health, immigration, social justice. We have populations both young and throughout the life spectrum, communities of color, food insecure, homeless, quite a few, and then folks from Orange, San Bernardino, and Los Angeles, as we predicted. And again, this is a quick snapshot. I'm happy to see the diversity of interest and diversity of organizations that are represented, and really with the philosophy of the fund that through partnerships, it requires very diverse partnerships and multi-sectoral partnerships moving forward to address the needs in our community. So we could close the poll here and then move into our next slide, which is our strategic framework. And here you can see our what we're calling these 5 areas, but these are our pillars that guide our strategy and inform our initiatives. A lot of these words are familiar to folks. I'll share a little bit more. A focus on the upstream, social determinants of health. We'll get into that in the next slide, but a focus on equity, intentionally collaborative, responsive, and innovative. Let me reiterate: upstream, collaborative, community, and innovation. This all leads to equity. And I know equity has been a term and a word that's been much more prevalent in the atmosphere in our community over the last month or so. But equity is a founding, driving value and a goal for our foundation since our inception over 30 years ago.
Yeah, and if I may, Jason, thank you for setting this. Just to let everyone know, the session is being recorded. There was just a question of the link will be available after the session. And also to let you know that this strategic framework, we've been working with our board and with our internal leadership and community partners in really developing this framework. And it's really been developed as a result of our engagement with all of these stakeholders. And Jason and I will kind of walk you through each one of these pillars with some examples to really give you a sense of what that framework is for us and how this is really guiding the work that we're planning to bring forward in the communities that, that you serve and that hopefully we'll partner with you on. Okay, Jason.
So we go to the next slide, and really this is touching on what upstream and social determinants of health are. And I know for many of you, this is not new. It is really thinking and talking about how do we address root causes. The determinants of health are the conditions in which people are born, grow, live, work, age, I also say play and pray. These are the circumstances that are shaped by distribution of money, power, resources at various levels, global, national, and local levels. When we look at our grant making, traditionally we have worked and we've supported organizations that have provided services, needed services, emergency services in the community, and that is of critical importance. And there's elements of our initiatives that will continue to do that. But we realize we have to do more. It's what we call a yes and approach. Yes to meeting the immediate needs and investing in strategies that impact root causes, that address system inequities. And this is something that when we get into our initiatives and our plan for the future, really underpins those strategies as we try to work upstream, as we define what upstream means for the community partnership funds. So if you go to the next slide, it is really this focus on equity. And again, this term has been bandied about more recently, but health equity is something that we've been founded on, which is the equal opportunity for members of all populations for disease prevention, healthy outcomes, access to health care, which is regardless of race, gender, nationality, age, ethnicity, religion, sexual orientation, immigration status, language skills, health status, or socioeconomic status. So it's this definition of health equity that we're surrounded by and trying to achieve. But this is also about racial equity and justice and supporting strategies that operationalize investments towards achieving this equity. Within our mission, our tradition has been to focus on the most poor and vulnerable in the community. And we're attuned to what this means in our current context. I'll turn it back to Gabby to talk about our commitment to collaboration.
I'm muted. Our commitment to collaboration is, we don't see it as an activity. It's really more than a guiding principle. It's really the values that we have within the fund. And how do we best partner and collaborate, deeply collaborate with stakeholders in the community and at large. And you can see there's some examples here of some of our partners. Unfortunately, we can't include the list of all of our grantees because that'd be a little exhaustive. But just know that our intent in all the work that we do is really always being committed to this value of collaboration and partnership. And the next slide, please. And really, another part of the value of our value is we need to meet the community where they're at. We are not coming in with solutions. We're not coming in with models that we found out about at a conference. We see the community as experts in the field, and we see our nonprofits as partners with these community members. And so we take a lot of time, and this is the sad part is we would have enjoyed doing the open house because we really want to engage in these conversations and really listen more than us speaking to you. So just know that this is normally not our style. And what we do a lot of listening tours, and that's the way we've done a lot of the work. And really working with our board and working with internal leadership and partners such as Community Health Investment and others about this is what we're hearing. How do we best respond to this? And who should be taking the lead in this within the organization, within the fund? And so our role is never about we need to lead everything. It's really identifying those issues and working and bringing others to the table to think about how best to develop a strategy and approach to manage, to really work towards these solutions. Okay, next slide, please. And innovation. And I think that just aligns very nicely with our philosophy and our values of collaboration and really meeting the community where they're at first. Innovation has resulted because we're open to learning new models. Our board has given us support to take on a little bit more risk than other foundations. And that has resulted in some initiatives that have really been getting a lot of attention, but most importantly have had impact in the communities around policy changes, around advocacy, around building the community voice in partnership. And so the innovation is something that was not intentional in our thinking, but has resulted because we recognize the importance of continually learning and evolving as an organization, as a team, and as partnerships with all of you. So this is another way that we see a value in the work that we do in the community. Next, please. Okay, so Jason will share a little bit more about our focus areas. Let me just do a little introduction. We've identified 4 focus areas for the fund moving forward, and just want to give you a little bit of context before Jason walks you through them. Being part of Providence St. Joseph Health, as I've shared with you, there's a lot of opportunities for us to align and leverage both internally and externally. These focus areas were identified through a series of learning, listening tours that we did with funders, with grantees, with internal leadership, and really looking at our results from our community health needs assessments throughout the system, and also learning about our strategic plan as an organization. And so these were the 4 focus areas that were identified and approved by the board for us to focus on as we expand throughout the communities of Providence St. Joseph Health. Okay, Jason.
So you see these 4 focus areas: capacity building, housing, education, and disaster response, and I would say resilience that Gabby spoke about. You may think, for those of you who have been partners with the Community Partnership Fund in the past, might say, this is a little different. This looks a little different. I see housing, I see education, I see disaster. That doesn't sound like health. But in our strategy, we're recognizing the intersectionality between these issues, between the interplay of education and health, of housing and health, certainly how disasters affect the immediate needs that are related to health, but also how disasters disproportionately affect those who are marginalized and have impacts on their health and their community's health. And when we look at our initiatives that we've had, which are listed on the next slide, it really has incorporated these issues. We've really focused on these issues, even in our traditional historical grant initiatives. And here you see a listing: our Emergency Food and Shelter Initiative, which I know that there's a great many of those on the call that have been grantees or are actual grantees right now of this initiative. Our intersections and community building initiatives, our disaster relief and sustainability initiative, and innovations grants that we've done and had over our history over the last 30 years, and certainly especially over the last 5 years. These have been examples of the different ways that we have worked with and supported communities through innovative strategies, through community capacity building and leadership development, and delivery of services, and working better together. One of the initiatives highlighted is our intersections initiative. And I think this is really, as Gabby mentioned earlier in the presentation, it's meeting the community where they are, where we are, both in capacity, in need, in knowledge. We realize that it's not a cookie cutter approach to addressing these challenges. We know that factors and opportunities and challenges in the city of Anaheim look different than those in the city of Mission Viejo, and certainly look different than those in the cities of Victorville or Apple Valley or Adelanto, or will look different for those that are addressing those maybe same issues in the San Fernando Valley or the South Bay in LA County. With that understanding, we're supporting collaborations, and partnerships through sharing the opportunities, through sharing the strengths, and designing resources and designing activities that fit those opportunities, that fit that landscape. The intersections, the community building initiative, the nonprofit sustainability initiative, those are all capacity building efforts, just at different levels, at the neighborhood level, at the nonprofit organization level, and at the community partnership level. And I think that is a critical step and a prerequisite if we're getting to this upstream goal of equity. Certainly along the way, meeting the needs through service delivery, but also having system improvements, having opportunities to impact policy and build community capacity, build community power, and build a community voice. The next slide, I want to talk a little bit about our more recent COVID-19 response. And this is an example that came out of Orange County, but in varying levels, we were active across the regions where Providence St. Joseph Health has a presence. And these are 7 states throughout the West Coast mostly. But here in Southern California, our response over the last 3 months has been one of regional support, but also understanding that there needs to be flexibility. For those of you who have been a grantee, certainly with Emergency Food and Shelter, our FC initiative, you'll know that we were able to transition that to general operating unrestricted grants so that you would have the flexibility to go where you would need. Also working to repurpose some of the activities and the resources within our intersections and community building initiative, hearing and listening to the communities and your organizations in real time to address some of those real-time needs. As we look also as our role as a funder in this community, at least in Orange County, the fund helped convene our fellow grant makers to launch the Orange County Community Resilience Fund in mid-March. And really this was a convening that happened in early March before the closures, before the national declaration state of emergency, but really to help meet the coming emergency needs. And this resulted in activating our grant-making partners and our grant-making friends from different foundations and individual donors to leverage our investment in our activities to raise $4.5 million, which is then rapidly released back into the community to nonprofits in need. And that kind of leveraged impact, that kind of partnership is on top of the specific grant making that the fund has engaged in, that the Community Partnership Fund is engaged in. So we know that as we look forward to the future, we know that COVID-19, unfortunately, what we were thinking back in February, thinking that it would be, let's just get through the next 3 to 4 months and we'll get back to some state of normal. We unfortunately know that's not going to happen. We have to acknowledge that COVID-19, both the economic and the human and community impacts are real and are here for the time being, for the foreseeable future. We're not going back to where we were in February. If we go to the next slide, we'll talk about what we are trying to do. It's not getting back to where we were in February, nor should we want to. Inequity, disparities existed then. We were trying to tackle that back then. Instead, the next phase of work is an acknowledgement of the human and economic impact of COVID-19 and the need to foster and support collaborative community structures necessary for the long haul. This is also in line with what we are talking about in the field of philanthropy, in the field of grant making. Yes to funding services and meeting that immediate need, but again, a yes and approach where capacity and addressing root cause and addressing structures that will be there, not just to meet the needs of COVID, but to meet larger needs of communities, systemic needs of our community can be focused upon. So I know that many of us on this call have received what we're calling a letter of introduction, an LOI. A little bit different than the letter of intent that you traditionally see in grant making, but because in many cases this is an evolution of the Community Partnership Fund, we wanted to get out an opportunity that was open to all, but an opportunity that was focused not just on individual nonprofit organizations, but community collaboratives who would be here and be working on issues that affected communities that were impacted by COVID-19, but also are positioned to address the issues like housing, like education, like food security, like health access. Certainly there is that effect that COVID-19 has had on these structures and these institutions. And so with a long view approach, providing support to collaboratives for collaborative strengthening over the next 9 to 12 months, our hope is that we're building structures that we can continue to partner with well into the future. So we'll get more into that. I know we'll have time at the end of the presentation today to ask specific questions about the Community Recovery and Resilience Initiative, about the letter of introduction, and the coming request for partnerships. But if we go to the next slide, the work of the fund is not just about investments in grant making. It's also about research and field building. It's about sharing what we're learning, what we've learned from the community, elevating community practices, adding to the body of evidence, but also the promising strategies and innovations that we've been privileged to partner with you on. On this slide, you can see some of the activities, some of the publications that we've put out. This is really beyond funding, resources, and money for us. The Community Partnership Fund engages in this kind of research and sharing of best practices to inform the field, the nonprofit field, other grant makers, other funders, government, other stakeholders. This is part of working upstream and sharing the knowledge, sharing the information, but also in doing this, activating other resources that may be from outside of our foundation or even outside of our health system to support movements, to support, again, this journey towards equity that we have and our goal. I'll turn it back to Gabby again to provide information on our expansion.
Yeah, thank you. And this is the last section before we get into some questions. And I could tell we have a number of questions lined up for us. So just wanted to give you a little bit of context. We're referring to an expansion. We are now Providence St. Joseph Health, and our footprint has expanded beyond Texas and California. Now we're in 7 states. So this is an amazing opportunity for us to work in partnerships with all of these diverse communities with diverse assets and contributions in really working towards a healthier community everywhere that our hospitals and our system is present. And so for Southern California, on the next slide, this gives you a little bit of a view of how we're also expanding within Southern California. So we were Orange County and High Desert, and now we're also in the LA area, and there's 13 hospitals in these 3 counties. And so we have some new communities in San Fernando Valley, in the San Pedro area, the South Bay area, in West LA, which is like the Santa Monica area, And so we at the fund see a lot of opportunities, not only in serving these 3 distinct communities, but really thinking about how do we create a regional approach to some of the work that we're looking forward to engaging with all of you. So more to come. And again, we look forward to meeting with you in person in the near future. But I think now we're getting into the question section.
So again, I think because of the number of participants we have, unfortunately, we can't have a general session where people just jump in and ask questions. So please add them to the chat box. I know that there have been a few questions about, well, what does this mean for our active grants? I know that we have some multi-year grants that are active right now. Our community building initiative, for instance, those grants are still good. We're going to still be with you over the next few years. Our intersections initiative, our community building initiative, those are some multi-year grants that we have. We're not leaving. In fact, a lot of the innovations, a lot of these strategies that we are building upon and we'll be looking to release later this year and in the years to come in 2021 are built off of the learnings that we've had from both the community building initiative and the intersections initiative, as well as the focus areas from our emergency food and shelter initiative. I think it's about, again, this approach of yes and, meeting the needs, but also addressing the root causes and creating solutions that have systems impact. I think there was another question about our region, and I think there are some questions about, I see that LA is included here. Traditionally in Southern California, the Partnership Fund, when it was known as the St. Joseph Health Community Partnership Fund, was active in Orange County and in the high desert region of San Bernardino, which is a community clustered around Apple Valley, Victorville, Hesperia and Adelanto and some areas around there. As we've come together with Providence Health to become Providence St. Joseph Health, that includes, like Gabby said, expanding to areas where Providence has had a traditional service area. And while this may not be all of LA County, it's, as Gabby said, the areas that you can see on this map, the South Bay, West LA, the San Fernando Valley, and certain, perhaps some regional areas in LA County. So I guess it's expanding the family a bit and looking to new partnerships. I know that there are some partners that are active both in LA and in Orange County, and so we're happy to expand our work with you. We know that there are partners that are active in San Bernardino and LA County, and so we're happy to work there. But I think it's bringing together these distinct regions within one larger geography to leverage our impact, to share strategies, to apply some of the lessons from our initiatives into different locales. We'll double check if there's any other questions. And if there's other questions that come up about our history, our approach, our expansion, please feel free to enter them in the chat. We can get there again before the end of the presentation, but we can also follow up with you directly. There'll be an opportunity for you to share in the breakout session to come immediately after this, but then we are open and always willing to spend some time on the call or set up another Zoom meeting so we can talk face-to-face and hopefully in the near future meet face-to-face to learn more about each other. So we're happy to set up those individual organization by organization opportunities. So let's see. I think now, given the time, let's move into our breakout sessions. And this is something that I think we're really excited about. Unfortunately, again, we're not able to meet in person. Otherwise, we would actually have tables and we'd have some cookies and coffee for you and some snacks. That we wanted to really break bread with everyone here, but we'll break some bread virtually. And so over the next few minutes, we'll have the opportunity to break out in smaller groups so that we can have some discussion, that you can share what is on your mind. And, you know, in particular, these questions about what collaboratives you're involved in and certain hopes for this opportunity. So I want to turn it back to Paul from our Charitable Ventures partners to walk us through the breakout group.
So hello, everybody. Again, what we're going to do now is in about a minute, you're going to get an invitation on your screen to join a breakout group. Please do join that breakout group. You will be moved to that group. You don't have, there's not a new different Zoom or anything. You'll just automatically be moved to that. And we'll spend about 15 to 20 minutes in that breakout group. The group already has a pre-designated facilitator who will walk you through these questions. And then in about 20 minutes, you'll receive a invitation to go back into the main room. You just have to accept that invitation, or if you don't accept that invitation, in a minute, you'll automatically be moved back into the room. So you don't have to, there's no new Zoom or anything. Zoom will take care of everything. So again, we're gonna tackle these questions and we will reconvene here at 11:10. 11:10. Does that work, Jason?
Yes, it does.
Okay.
So thank you.
Great. So now you should all be seeing an invitation to move into the room. So just please say join and you'll be in there immediately.
How's Mr. Joey?
So 11 o'clock is, I don't know.
I think that regardless of race or ethnicity, that people are not discriminated against and are able to, again, get basic needs met and access care. And also being able to pay affordable salaries to staff. Those were some of the big magic wand ideas. Thanks.
Okay, so I think my group is next. So let me exit out. So we had a lot of different ideas. One of the main ones was that we just need to figure out a way to leverage relationships with other community partners in order to best provide support and share resources. And a follow-up thought to that was just being able to have more forums such as these to share ideas. Another one was also talking about affordable housing, and some examples of that was creating some sort of shared housing system or even tiny homes was a thought. And then also we talked about inequities, so space inequities, racial inequities, connecting or finding better ways to connect food insecure families to all the resources that they might need. Talked about providing services to the immigrant community, also mental health, especially in what's going on right now when a lot of services are being held virtually. And another big thought was just, we are going through a community trauma and just trying to figure out what we can do and where we need to focus our efforts. So we talked about a lot of different things. So that's what I got.
I think Haley.
Hey.
Oh.
Well, as the last report out, I don't have a lot to share that is new because there is a lot of crossover. We spent quite a bit of time discussing collaboratives, and so I learned a lot of about new collaboratives in the Los Angeles region, and was reminded of a lot of collaboratives in the Orange County region, and it was mostly around affordable housing, permanent supportive housing in general, homelessness, hunger, the Orange County Opportunity Initiative, so immigration and refugee services was also discussed. So there's a lot of collaboration, a lot of formal collaboration and some informal collaboration, and both are good. And so it was good to hear about them. And then in terms of the BHAGs, my bad as a facilitator, I wish I would have had more time, honestly, to hear more from you. But what the time constraint allowed us to do is be very simple and say exactly, everyone said exactly what the needs were, and there was total crossover.
the goals are around guaranteed housing, you know, ending housing insecurity. So providing more affordable housing, housing for everyone, ending food insecurity, providing mental health support. And that was really like the main concern among everyone, and the main goal. And then also there were a group of folks that definitely spoke about the very important need of providing services for all those immigrants that are in detention. So I would say those were the prominent topics discussed. And we didn't discuss how we get there, and that was kind of by design. But I think it's really exciting that, you know, you all are in the field, and you can work together to create those solutions and meet those goals. That's all I have.
Thank you, and thank you everyone. Thank you to our facilitators for collecting and working us through the conversation. I will share a little bit what I shared in our group, that it's 10 to 15 minutes doesn't do this justice. That our dream, our hope at the beginning of the year was that we would all be together in a big auditorium sharing cookies and coffee. I know some people on our call are waving their coffee at me. I don't have coffee with me right now, but you know, I think you can get a sense from us. We're not formal. We're not stuffy. Well, I think we are partners. I think each and every one of our staff members for the foundation have worked in community, either at a community nonprofit or an advocacy group or in a service role. So we are just in a new role as a funder. And so we want to work, we want to partner. I made a point to say that all of our initiatives are not just designed in a dark room in a foundation with no windows, but have been co-designed with community leaders, have come from ideas from community organizations and collaboratives. And we want to continue that, and we want to offer that. And so while we only had about 10, 15 minutes in a virtual chat room, our door is always open, and we want to hear from you. We want to talk with you. We want to co-design and build together and struggle together. It's going to be a struggle, but want to struggle together as a partner for our community. And so I want to turn it back to Gabby as we close this portion. We'll have a little bit of time after that to talk about the LOI that's out there if there's people that want to ask questions. But I'll turn it to Gabby for some final thoughts.
Yeah, I just again want to thank all of you for your time, for your flexibility, for your engagement. Thank you to the facilitators and for Charitable Ventures for helping us putting this together. As you can imagine, this is one of 7 virtual open houses, and the last one will be right before Labor Day. So we're really looking forward to learning from all the communities. But just want to give you a little bit about what's coming next. In the next 6 months, we talked briefly about the Community Recovery and Resilience Initiative. And so the LOI will be due July 30th. And we'll be going through a process, and once we have the board approval, then we'll be able to select recipients to support the work of the collaboratives in this new space that we've talked about briefly. We will continue to strive to learn about your communities. We have your email addresses. You have our contact information that I'll be sharing with you in a bit, but we will also proactively start thinking about what are other ways that we can engage with you and not lose any time even during this crisis that we're all experiencing in our personal lives. And importantly is really looking to implement the strategies and our commitment to the communities as part of Providence St. Joseph Health. And so the next slide just shares with you our contact information, our email address, our website. Please visit us. Please, give us a call. Email us and then we'll call you. We're all working from home at this time. But we really want to continue this conversation. We see this as the beginning of a conversation, and we want to engage and most importantly, learn about your communities from your perspective and from the communities that you serve. So this completes the session, but as Jason shared, we have some time to answer any questions you may have about the LOI that's due in about 2 weeks. So if you'd like to take advantage of this time and ask us some questions, we're here. So let us know. We'll just wait and pause and wait to hear from you.